Welcome back. This is Good Morning Namibia. For years, international aid from USAID helped save lives across Namibia, bringing medicine to clinics, training health workers, and turning the tide, especially on HIV. But now that support is winding down, and the responsibility of sustaining those gains has now been shifting, that is towards local hands. Today we're joined by Madam Mirjam Matheus, a key voice in Namibia's health sector, discuss what this transition means on the ground. We'll explore how communities are coping with reduced funding, what's being done to strengthen local systems, and the critical role of leadership, innovation, and community engagement in moving toward full self-reliance. This is not just a policy shift, it's a human story of resilience, adaptation, as well as hope. Good morning, ma'am, and welcome back to Good Morning Namibia.
Good morning, Mr. Denver. Thank you so much for having me. Good morning, Namibia.
How are you doing on this gift of a Tuesday after a long Easter weekend?
I'm doing well. I'm well rested, actually, so I needed the weekend, the long weekend. So, yeah, thank you. And how are you doing?
I'm doing well too, thank you. I didn't rest too much,
Okay.
but I'm very happy to be here nonetheless.
That's great to hear.
Yeah. You wear multiple hats.
Yes.
Firstly, how do you balance all of those roles?
I will say early on I've been exposed to leadership positions, and I will say that has enabled me to position myself in a place where I always constantly want to have a contributing factor, or to be a contributing factor towards my community. So I will say I have already, since early on, developed that resilience, because I'm always constantly on my feet, thinking to myself, how can I assist my community? How can I be of help to my country? How can I be of help to the system that I'm in? So I will say it's a resilience mechanism that I've developed over time. So now I love it. It's something that I'm used to. So I actually find it weird when I'm not,
On the move and on the go.
Exactly.
But we also need to strike a balance, right? Because rest is
Yes.
equally important.
That's true. That's
Some of us
true.
have difficulty with that.
Yeah, that's
Is that
true.
also what inspired you to pursue studies in medicine?
Yes, actually. Okay, no. Let me be honest. I was inspired to study medicine since my primary years because I wanted to become a pediatrician. I've always loved kids, but now also now having entered the system, it exposed me, it opened my eyes to so much that I could possibly wanting to do. Also, I love helping people. Just me interacting with my patients, that brings so much joy and satisfaction. So I would say that's mostly what led me and is still maintaining me in this field of medicine.
Now, there cannot be any doubt about the impact that the help from USAID made in terms of particularly HIV prevalence in this country and dealing with that.
Yes.
Speak to us about that impact, please.
Okay, so where can we start? USAID has been truly a reckoning force. I would like to start off with the strengthening of HIV/AIDS program. So USAID has really been playing a pivotal role in Namibia's fight against HIV/AIDS, whereby they have had substantial financial support that has been helping, or that has not just helped establish, but is helping to scale the antiretroviral therapy medication, which is life-saving medication for people living with HIV/AIDS. On top of that, we have the UNAIDS target, the 95%, 95%, right? And currently where we stand at in terms of treatment status awareness, we had 92%, treatment accessibility, we had 99%, and viral suppression, we had 94%. And these are great outcomes, and USAID has had a major role when it comes to this. And then also you have health systems strengthening. So also, if I was just to slightly put the HIV/AIDS aside, it has been really playing a huge role in terms of creating robust health infrastructure, also when it comes to, which includes maternal health as well as child welfare, if I was to put it that way. And it also has helped in terms of programs such as TB as well as malaria. And then also on top of that, because you asked me on HIV/AIDS as well. We can't forget about the task force and the capacity building.
Technical support.
Yes,
yeah.
exactly. It has been funding programs that have been training community health workers, doctors, as well as nurses. And these are the same people that are constantly on the ground. Also, when we talk about decentralizing of healthcare into rural communities, we're talking about rural access, bringing preventive healthcare to marginalized communities or people that need it the most, for instance, adolescent mothers or young women. So really, it has been doing a lot. And this is just me generalizing because...
However, with the re-election of President Donald Trump and his subsequent executive orders, a regime change is being witnessed.
Yes.
And that funding is, at the very least, for the moment, frozen.
Exactly.
What impact has that had thus far? Number one. Number two, what is it that we need to do as a matter of urgency to not lose out on those gains? Okay,
so the impact that it has had so far, it has deliberated HIV/AIDS program. I think I already went into that. And then number two, also we have...
But that's very serious.
It is.
Could we see a resurgence of HIV?
Actually, we could, if you think about it. Because if you, 71 point something% of Namibia's youth, of Namibia's population is youth. And withdrawal of USAID means that we are removing away preventive health care. We are removing away all these essential health services towards our youth, number one, because these are the same people that we are expecting to carry economic emancipation for the country. So if we are not catering to this, or if this whole factor is involved, then definitely we are set to see a regression, and it's something that we need to deal with hands-on, because 71 point something% of our population, number one, is youth. So this is a serious issue, and that's also one thing that I'm passionate about, that I am constantly advocating for, is how are we going to cater to our youth in this whole transition, because we don't want to throw them back in the street. We don't want a rise in HIV infections or STI infections. We don't want a rise in teenage pregnancies. We don't want that. So definitely it is a serious issue.
So what needs to happen looking ahead?
What I will say needs to happen, number one, we need to prioritize domestic health funding, whereby we need to have a constant investment in our health system and not necessarily always be reliant on donors. So that's one thing that's very important. So we need to make it an imperative point when it comes to the national budget and health. And then we also need to think about enacting national policies that can assist in reabsorbing or retaining or rewarding this the task force, the frontline workers. Because like I said, these are
many of them lost their jobs.
Exactly, exactly. And these are the same people that have helped us to get all these targets, this UNAIDS 95% targets. These are the same people that have been helping us to bring healthcare to marginalized areas. These are the same people that are assisting us in terms of decentralizing healthcare, because it is an issue for a country like us, whereby most of the infrastructure is usually urbanized. But what about other areas? And equity is definitely and should never ever have to be an option. It should be foundational. So these are some of the things that can be done. And then we can also, of course, we have other partners as well. We have global funds. We still have WHO. We still have UNAIDS. So really, at the end of the day, it's getting multiple sectors to work together, getting private-public partnerships to work together, because we cannot work in silos. We have to work unified. Yes.
Do you think we saw this coming, or were we caught off guard?
I would say we were caught off guard, Because if you look at the measurement that I'm looking at is the fact that we are not able to absorb our health workers, because now it's an issue of budget constraints, it's an issue of recruitment procedures and all that. The fact that we cannot already absorb our people
right away,
that's an issue. Also, still now we have to find ways on how we can have a sustainable health system in terms of also of funding, of domestic financing, whereby once again I strongly advocate for this, because majority of our population is youth, whereby we now have to find ways to cater to all these people.
Although young people are not the only ones who are sexually active, young people are not the only ones who are on HIV treatment. They're not the only vulnerable people under these circumstances, but they do constitute the majority.
That's true.
So in the interim, while we find ways to continue, while we find ways to mitigate, what do we do in the interim, in the immediate term?
What can we do? What can we do? I would strongly suggest, number one, I'll strongly suggest that we have sectors working together. I did mention that before, but it's very important that we don't work in silos, that we mobilize different sectors to come together, that we mobilized partnerships so that we can fund our own health system, because we cannot be reliant on donors. We cannot be reliant on external aid. It's time for us to act boldly. It's time for us to act smartly. So we can start there. Then also in terms of community-wise, empowering communities, it's very important that we understand that we cannot just be beneficiaries. We need to be innovators. We need to be problem solvers, and also we are basically the future as communities and youth. We are basically the future policy makers. So we constantly also need to engage the community and for them to understand that they are the heart of the health system. Another thing perhaps that we can do is I'm strongly on, I'm happy the fact that our government is standing in terms of procurement with the ART, etc., and also the fact that we have taken up universal health coverage. So really these are amazing things.
Does the ABC strategy still land as far as young people are concerned regarding HIV prevention?
Does the
ABC strategy, maybe it's not something that lands even in terms of language. Abstinence, be faithful, and condomize.
Is it something that lands in terms of the youth?
Yes.
My. I will say that's now where the importance of the civil society organizations came in, because they helped in terms of implementing this in young people. So yes, it does land.
At least as a crisis intervention.
Yeah. Yes.
Yeah. Any final thoughts before we let you go this morning?
My final thoughts, number one, is just that we need to come up with policies whereby we can assist to retain, reward these health workers, because we need to increase our frontline capacity. We need hands. And then number two also is just an advice on or calling out on the community to come together and work together. And also just on investors that do not mistake progress to not mistake progress to completion, and that sustainability is not a finish line, but rather it's a process. So please, let's all work together. Let's work in silos so that we can...
Let's not work in silos.
Let's not work in silos. Let's work in unity so that we can take ownership of our health system.
Thank you for your contribution. Thank you for your insights. And thank you for the great work that you do.
Thank you so much, Mr. Denver.
When you're back, we call you Dr. Mirjam.
Yes.
Yeah.
Thank you so much.
Madam Mirjam Matheus, chairperson and founder of the Becoming Health Namibia. She's also a final year medical student, speaking to us about the impact of the executive orders of President Donald Trump regarding particularly HIV prevention efforts in this country.